This is our Capstone project, Early Recognition of Pediatric Sepsis. I'm Erica Evans.
I'm Anna Carson.
And I'm Rebecca Wilson.
For our Capstone project, we decided to center it around pediatric sepsis. We all started on our co-ops at Cincinnati Children's in the beginning of the semester, which had us spending more time with the pediatric population. Before starting, we all talked about how we had little to no knowledge about most things surrounding sepsis, and after the past 8 months of co-op, we have recognized how prevalent sepsis is in the clinical setting, and we see it so much more than we expected. Our research has made us discover that sepsis is one of the most leading causes of pediatric morbidity and mortality, and that early recognition and treatment is essential for positive outcomes. We then began to think of ways we could educate current nursing students on this topic before they enter the pediatric setting. This is our PICO question in which we decided to base our research upon. This question is, does the implementation of education on early recognition of pediatric sepsis for undergraduate nursing students improve their knowledge on early recognition for pediatric patients?
We then took our PICO question and started to collect data. We researched the background of early recognition of sepsis, as well as the importance of early recognition of sepsis in the hospital. We had a few issues finding specific articles for pediatric sepsis versus just adult sepsis. We also ran into issues finding recent articles within the past 5 years that gave us current and updated information. The two databases that we used to detect this information was CINAHL and PubMed. The keywords that we used to find our articles were pediatric, early recognition, outcomes, sepsis, sepsis rate, and sepsis presentation. We each found 4 articles each, so we had 12 total. To administer the data that we found, we used a recorded PowerPoint and we administered it to an undergraduate class of pediatric nursing students. We used informative slides, such as the signs and symptoms of pediatric sepsis, as well as how pediatric sepsis can be spread. We also used YouTube videos and practice questions for the nursing students to practice the knowledge that they are learning. We also used tools from hospitals such as Cincinnati Children's and Children's Hospital of Philadelphia, and the tools that they use to detect sepsis.
We determined that administering a pre and post test would assess the students' knowledge at baseline compared to how much they learned from our presentation. We created questions based off the content in our slides and used different styles of questions, including single response and select all that apply. When analyzing the results, there was a 20% increase from the pre-test to the post-test, jumping from an average of 78% to 98% of the questions correct after we presented our data. We also asked the students how comfortable they were with recognizing sepsis on a scale from 1 to 5 before and after the presentation. Before our data, the students averaged a 2.31 on comfort levels for recognizing pediatric sepsis. After the presentation, that number increased to 3.85. Overall, the nursing students felt more comfortable being able to recognize the early signs of sepsis after our educational intervention. We believe education of nursing students is essential to the timely recognition of sepsis in order to improve positive outcomes. And we hope that this will help increase recognition as the nursing students complete their clinical rotation and enter the workforce. Thank you guys for coming and listening to our Capstone project.